According to Médecins Sans Frontières, or Doctors Without Borders, Afghans are facing widespread instability, mass displacement and the disruption of basic services, including healthcare. The aid body says that most patients are suffering from respiratory illnesses, gastrointestinal problems and trauma-related injuries sustained in the fighting and road traffic accidents. From August the 15th to the 21st, more than 3,600 people were treated in the emergency room and 415 were admitted to hospital. For an update on the humanitarian situation, we're now joined by Borrie, who's the head of communication at Doctors Without Borders Southern Africa. Thanks very much indeed for joining us and welcome to the program.
Thank you very much for having us this evening.
All right, so tell us a little bit about what your challenges and the efforts that you've been able to put on the ground in Afghanistan, dealing with some of the things that we've just described.
Yeah, I think it's worthwhile that we start off just giving everybody a bit of a sense of like what we do on a normal basis. So we are operational in 5 different locations across Afghanistan. So in Kandahar, in Kunduz, in the north, in Herat, in Khost, and also in Lashkar Gah in the south. So these are ongoing projects that we run, providing medical care that is free of charge and in impartial and in an independent manner. And we've been doing so for many years. We've been working in Afghanistan since 1980. The only time when we were interrupted from continuing our activities was between 2004 and 2009, when we returned again to Afghanistan. But yeah, the situation is, I would say, there's a large degree of uncertainty, but there is calm at the moment in the places where we're operational, where we run our projects. We can see that there's a definite increased need for healthcare services. So in the beginning of August, there was still quite a lot of fighting that was occurring. By mid-August, the fighting had ceased, and what we can now see for the last 2 weeks or so is a significant influx of patients to the facilities that we're running, more particularly in Lashkar Gah, where the hospital is absolutely full. So we have a 300-bed capacity to provide care for patients there, and the emergency room of that hospital is seeing around about 800 people a day. And the reason for this is that as the fighting had ceased, it's much easier for people to be able to move around. But it also means that many people who've sustained injuries also have their conditions affected by this waiting period that they had imposed on themselves because of the lack of security in some of these areas that the fighting was pretty heavy. So I think in the end, like if we think here, what are the main challenges for us? It's essentially what normal everyday people would experience. So a significant disruption in transport, our ability to move supplies and staff around the country as needed in the facilities that we operate.
In the introduction there, we spoke about respiratory illnesses and gastrointestinal issues. What would be the cause of seeing high cases of this?
No, it's an excellent question. And normally those conditions are associated with instances where people are displaced, when they're living out in the open, when they've had to kind of create makeshift shelters for themselves, when they've had to flee their homes without much time to prepare or to take many things with them. And so this is particularly true in the areas where we're working, which saw significant levels of severe fighting, where people fled to try and keep themselves safe, to try and keep their families safe. And so these kind of conditions that we see are not unique just to Afghanistan, but it's also present in other contexts where we're operational and where we provide medical care.
I would imagine living in a war zone, a lot of people probably also present psychological issues.
Yeah, and that goes without saying. There is a degree of psychological trauma, people witnessing extensive violence or being targeted themselves in violent acts. So that is definitely of concern. What we can say, more particularly when we're talking about the current situation in some of the facilities that we're running, particularly in Kunduz, which is a a city to the north where we operate a trauma center there, providing emergency medical care, specifically to people who are either injured in traffic accidents or who are war wounded. There, we've just managed to move roughly 25 patients from a makeshift facility that we had in our offices there to a newly constructed trauma center that we've been working on for about 3 years now. That was rebuilding a new facility after, in 2015, US forces targeted our trauma center in Kunduz, destroyed the facility, and killed 42 patients and some of our colleagues as well. So we're
hang on. Let me just get that right. You said US forces destroyed a hospital facility.
Yes, this was in 2015. So this was 6 years ago. And that was during a situation of conflict.
All right. So was it a mistaken identity? They thought they were hitting something else?
At that time, in 2015, while this attack was occurring, we were in contact with US commanders, and we had told them that what you're striking is a hospital. And working in conflict zones, it's very important that we're able to identify our facilities clearly and that we're able to give the exact coordinates of these facilities to the parties involved in the conflict to avoid situations like this. So that was back in 2015. We haven't had a situation like that since. It is true that Afghanistan is a particularly complex and quite a volatile context to work in. More recently, last year in 2020, a maternity ward at Dashtabashi in Kabul was the site of an attack by an opposition group that left 14 of our patients killed and also some of our staff. So it is an incredibly complex and difficult place to work, but we've been remaining active and maintained our activities despite the uncertainty that we've seen over the last month or so with this very swift change of power, and also significant moments when there were quite intense levels of conflict in the country, in the places where we work. So just to give you a sense of what we're talking about today, the medical needs that the population of Afghanistan experience in the places where we work, we're still able to continue doing work in Kandahar, where we're treating almost 40 drug-resistant tuberculosis patients. We've managed to maintain their care, to avoid a situation where their care is interrupted. So that's quite important for us. As I mentioned in Kunduz, we're able to continue to provide trauma care to patients who need it. In Khost, we're still able to maintain a maternity clinic where we see roughly 48 deliveries of babies per day.
Wow.
And there are currently 33 infants who are in our neonatal ward. So despite the insecurity, despite these challenges, we're still able to work. And this is important that we also understand how we're able to do this. For many years, we've been able to maintain negotiations both with the Taliban, but also with the former Afghan state, and also other parties like the ISAF forces, to let them understand that the way in which we work is precisely only to deliver medical care without any agendas or any political affiliations whatsoever. We're a completely impartial and independent medical organization. We treat whoever needs our care. It doesn't matter whether they're a person who's involved in a traffic accident, an opposition group fighter, or any other fighter for that matter, or whether it's a child that's just been born. We have absolutely we do not discriminate in any way. And people have understood this in terms of how we've been able to work. And this is what's largely been part of what's kept us operational for all this time, and it is currently also what's understood by the new powers.
Has the Taliban given you assurances that you'll be allowed to carry on and serve the needs that are so evidently there?
So far, we've received assurances in the locations where we're working. So in those 5 project locations in Lashkargah, in Kunduz, in Khost, in Kandahar, and also in Herat. So we've had no difficulties whatsoever to maintain our activities. We've been given the assurances that we should continue with our work as normal. And that's exactly what we've been doing. Yes, under difficult circumstances, we're not able to do staff rotations. So, for instance, in Lashkargah, where we've seen this massive influx of patients, it is normally what we would be able to do is after some period of time, we can send a relief team to relieve some of the staff that are very fatigued with that level of patient load that they're dealing with. We have not been able to do that. It is also true that while we have stocks that can last us several weeks still, in the longer term, we do need to have more certainty around the viability of transport routes by air, predominantly where we use chartered planes to deliver supplies, stocks, and also staff to our project locations. We are also looking at alternative means how to do that, be that either by road from Pakistan or from Tajikistan. So a lot of what our teams are currently doing is trying to think of ways to have contingencies to keep our activities ongoing. As we're talking, now more specifically about the consequences of conflict, it's also important to note that COVID-19 is still a very real situation in Afghanistan. It's entering a third wave. It's true that we've seen a decrease in the number of COVID-19 cases that we're screening and that we're also treating ourselves or referring for further treatment. But vaccination rates in Afghanistan are pretty low. So we can expect that there will certainly in the future be yet another increase in COVID-19 cases. So despite the current uncertainty, I think the one thing that everybody would like to know and to understand is that we're able to continue the care that we do provide for patients. When we talk about what the prospects are in the future, it's really difficult to know. But for the moment, we have assurances. That means our staff can work safely, our patients can safely reach facilities. What we would like to see is more clarity in terms of how to maintain our supply lines.
Borrie, that's where we'll leave it. Thank you very, very much indeed for joining us, and we wish you the best with the very important work that you're doing in Afghanistan. Thank you so much.
Thank you very much for the opportunity. And we also thank South Africans for their continued support of our work in Afghanistan and elsewhere on the continent and in the world.